Welcome to Choosing Love. My name is Sherry-Anna Boyle, and I am your host. I am so excited about this show. I've been thinking about this show for a long time, and here's our plan. Our intention is to provide you with some clarity about what love is and what it isn't, as well as some conversation, right? Some healthy conversation about how to choose love. What are the benefits of choosing love? And most importantly, how do you choose love when you are facing adversity, when you are facing challenge or struggle? And that is what this show is all about. I am very excited. I have a special guest for you. She's our first guest, and I couldn't have picked a better guest, in my opinion. And her name is Stacy Richmond. She is a specialist in eating disorders. She does a lot of things, but I'm going to let her introduce herself. Stacy Richmond, welcome to Choosing Love.
Oh, thank you, Sherry. So Sherry and I have known each other for a very long time. I'm so pleased to be here, and I love your theme of choosing love. I am a professional nutritionist, registered dietitian, providing integrative nutrition therapy counseling for people who have various issues related to food and eating, and I have a special interest in helping people transform their relationship with food using a whole person approach, body, mind, and spirit. And the specialization with eating disorders, I hope to talk a lot about that today to give a little bit more insight and awareness about eating disorders, what they are, what they aren't, and how your theme of love is a big part of what I bring into my work. Also, a yoga teacher, trained in energy healing, and I mention that as a way to speak to the whole person approach, and that it's not just about the food, although the food is a very important part of helping people to connect with themselves in a healthy, loving way, but food is only one part, and how to bring in all the different aspects of body, mind, and spirit.
Right. Thank you. So, I have 3 daughters. So this topic has always interested me. I mean, I think anyone who, whether it's daughters, sons, it's such a great concern for people. And I'm wondering how we're doing. I mean, are eating disorders on the rise? Can you tell us more about that?
Statistically, eating disorders are not going away, unfortunately. And in terms of referencing on the rise, we used to identify disordered eating with young girls, adolescent teen girls. And what we're seeing is disordered eating is starting at a very young age, shows up in slightly different ways than we might imagine. A classic person who experiences anorexia or bulimia spans the adolescent teen years, and now we're looking at young adulthood, and we're also looking at later stages where adult women are experiencing disordered eating. In addition, we could call it an increased rise with men, but part of that isn't so much just statistically more men who struggle with eating disorders, but some of the screening and some of the education and awareness, because boys and men don't enter the healthcare system the way girls do, so some of the classic criteria may not be identified in men.
I know this is a huge topic. I mean, we could do a series on this, and so many questions are running through my head, and I always feel like the first step is getting some clarity, right? So educating ourselves exactly what it is that we're talking about.
Right.
So if you could clarify what it means to have an eating disorder, just...
Yes. So I like to have people consider the spectrum of disordered eating for a moment. And if you could imagine, on one end of the spectrum is normal eating. And on the other far end is classic clinical eating disorders, which I'll talk a little bit about, the classic anorexia, bulimia, binge eating. And somewhere in the middle, I'm going to have you imagine chronic dieting for a moment.
Okay.
And the reason I mention that is because chronic dieting in and of itself is a high risk factor for developing disordered eating, which then can set somebody up for a classic eating disorder.
Okay.
So if we look at the spectrum of disordered eating, if I reference and talk about the classic clinical eating disorders, there's been a revision in the diagnostic manual that identifies different categories. So again, a lot of times people think about disordered eating as a starving waif body type
Right.
that doesn't eat anything. So a classic anorexia, or somebody who's purging, they eat and they purge their food after eating. But there are a few other categories that are important for people to understand or just to become aware of.
Okay.
There's avoidant food intake disorder and avoidant restrictive food intake disorder.
Okay.
And this is showing up mostly with younger children who may have had a traumatic or upsetting experience around food and eating that causes them to reduce their intake and impact their nutritional health and wellness. Some
Okay.
examples of this would be if a child had an upsetting experience with vomiting or choking and is afraid now to eat for fear of gagging or choking.
And so fear of the gagging. Okay.
Correct.
Because one of my daughters got food poisoning. And it was awful. It was this disgusting cleaning that up. I mean, you could tell.
She had it. Yes, right.
And now she just can't even stand the thought of eating that kind of meat again. So
Exactly.
would that fall in that category
If
where
it
somebody
become-
had food poisoning?
It
or?
can. So if you think about the vulnerability, if that individual who
Yeah.
experiences that fear gets to the point where they start to cut off more and more the foods that
Okay.
so it could start with the offensive food. It could start with, okay, it was the burger. Okay, so
Okay.
I'm not going to eat burger and I don't want to eat red meat, and that makes sense. You know,
Right,
that's
right.
somewhat of a normal reaction
I-
for
right.
anybody who's had a bad reaction with food.
Right.
The concern is when it starts to expand into, I'm afraid to eat dinner. I'm afraid to eat
okay.
at the cafeteria because I don't know how they're making the food. So what
Okay.
happens is when it starts to expand its
Yeah.
definition, and then it starts to impact overall intake. So somebody can become more malnourished. They may start to lose weight. They may
Right.
start to experience lack of concentration due to inadequate intake. We could see these symptoms with a child who might become phobic of a certain food of a certain color
Okay.
or a certain texture.
That's interesting. So now what about, are there more categories than that?
There's another category. So
Okay.
a lot of times, if you look at the classic criteria, which is another show, just maybe another time,
Yeah.
a lot of times somebody might say, oh, well, I'm underweight and sure, maybe I feel fat. So the classic definition of anorexia may be loss of body weight, 85% of typical, though that person sees themselves as large or overweight. Another classic part of the diagnostic criteria is loss of menstrual cycle. So there's a whole other category for when somebody has classic symptoms, but there may be an outlier symptom that doesn't fit the classic criteria. So that is its own category.
Wow, this is really complex. I mean,
Right.
you really need to go to someone who knows what they're doing.
I mean, I guess I guess saying it all, it's just what I do. I don't really realize the complexity.
It really is. And what about if somebody's eating too much? What about children that are
Yes.
overeating or
Yes.
overeating the same thing all the time, or using food to soothe themselves, or because there's a lot, my focus is anxiety, so
Yes.
there's a lot of that, and I know that is not
Exactly.
going away. I love the way you put that.
Yes, it's not going away. And it
Yeah.
is its own category. That
Yeah.
is a new addition to the diagnostic manual as well.
Okay.
They have included binge eating disorder
Okay.
as a clinically significant disorder.
Okay.
And just because somebody overeats doesn't mean that they're a binge eater. There's,
Right.
again, very specific criteria
Okay.
to identify when is it, I'll call it overeating,
Yeah.
emotion eating, or much more emotion, impulsive driven, where food is being used as a drug.
Right. And I think of all of us parents, including myself, and I remember being parented this way, where I would be upset about something and my mother would say, "You want a cookie?"
Exactly.
You want something to eat?
Exactly.
You know, and I find myself as well, well, let's just get something to eat and everything will be okay. Right? So that's just something that comes to mind. But so what is some advice for us parents? And it sounds like if you're concerned about your child or yourself or a loved one or a friend, that you really need to go to a specialist. I mean, this isn't.
Yeah, I mean, I guess in this day and age, sadly, with all of the conflicting information about food and eating, I do have to say the food confusion that parents have, and I'll reference it as a generational concern. You know, when you think about the way we've moved forward with food and eating and food labeling and all the different dieting messages, it has created an environment of significant confusion, fear, and shame around eating.
I mean, this whole thing, don't eat gluten, that was a big thing for a while, or low sugar, or diet, there are so many messages.
Exactly.
It is confusing for a parent. So what do you recommend if a parent is at the beginning of their journey, or how to?
Well, I think what you're bringing up is a dynamic question, and I say that because if we could categorize some of what we're talking about as what is general good advice for cultivating positive messages around food, eating, and body. Okay. And then we have how do you address or work with when there may be a problem.
Right.
And then how do you work with and address when there really is a problem? So there's a spectrum to consider to answer your question. So it isn't quite so neat and tidy. And a lot of the work that I do is about meeting people where they're at and personalizing the intervention.
Gotcha.
Because every dynamic can be a little bit different. There are some commonalities that affect everybody. Right. But that is in alignment with my main message.
Now, let me ask you this, Stacy. Do you find that some people sort of do things because they believe that they're choosing love, when in fact they're choosing fear? Because I think of that, this is one of the messages I want to clarify for people when I say clarify what love is and what it isn't. And so many of us have been conditioned that love is doing. And I know with myself as a parent, sometimes I'm doing so much that I miss things, right? I'm so into the staying on top of things, keeping up with school, keeping up with homework, keeping up with just the shopping, that is there something that as far as this love message, what is a loving response that we could do for a parent? I'm kind of answering my own question a little bit.
Isn't that interesting how that happens, right?
Just feeling like sometimes we do need to slow down and ask for support, but I want to know your thoughts on that.
So what I'm hearing you ask me is, what are some ways for us to look at nourishing ourselves? There's, think about the difference between feeding and nourishing.
Like that.
Okay.
The difference between feeding. So you're talking about feeding your children, feeding yourself.
Correct.
And nourishing your children and nourishing yourself.
Correct.
Okay.
Okay, so the definition or the act of eating or feeding is a mechanical action, basically.
Right.
Okay.
Right.
Nourishment.
That's the doing.
That's the doing.
Yeah.
So nourishment has that layer, that component of love.
Ah. Okay.
You know, I asked a client once.
You're so right, though. The feeding is the doing.
Right.
It's the mechanics.
Correct.
Nourishing. Okay, keep going.
And I asked her, I'd like for you to tell me a little bit about how you feed yourself. And she got very confused because she couldn't wrap her brain around the idea of her actually having that action towards self. It was all outside of self. I feed my family, I feed other people. And there was a big disconnect.
I can see that. I mean, I'm trying to answer your question. I'm like, well, I eat with a spoon.
Right, right.
Like you automatically think, feed myself. It's a mechanical
Exactly.
process.
I could pick up the fork and put the food in my mouth.
Yeah, get the plate. Wow, interesting.
So if we layer that with nourishment, and like you said, people are running and hectic, moms,
Are
kids,
we
everybody.
missing the signs? That's what I want to ask you. Are we missing the signs? Do you find that we could pick up on things a little bit more, or is this genetic? Is this more cultural?
So let me go back to tie it to where you're at. The idea of slowing down in nourishment, the function of that is if we could start to become aware of the power of slowing down, breathing, coming into the moment, we are more aware, awake, and in tune with what's happening, not only in our own body, but in our family system.
Right.
So the cornerstone of
geez,
identification.
I'm thinking of my family meal.
Right.
It's quick. I mean, the preparation is the preparation, but by the time we sit down together, very often it's quick.
Right.
So that's really interesting.
Right. So how to slow the process down? I'll invite families to do take one mindful breath together before they eat dinner.
Oh, nice.
Take a moment. And so if I work with an individual, I encourage them to bring it back to the whole family system. So that it's not only something that individual I'm working with is working on, trying to slow down, but it's being brought into the family meal.
I love that. I love that. So everybody take a breath together.
Right.
Eat your meal, and then we're in nourishment.
Exactly.
But when we're forking it,
exactly.
we're in feeding. I love that.
Oh,
that is so helpful. That is so clear.
So I wanted to lay that foundation, Sherry, to bring us to your question about well, what are the signs? If we're more connected and we have a greater sense of our baseline, and we can slow down, we can start to maybe see some early warning signs.
So what do you mean by baseline?
So if we could slow down and come to baseline where we are aware, where in the present moment, okay, everybody's here, so-and-so's fighting with so-and-so at the dinner table, but everybody's, they're finishing their meal, everybody's participating, like whatever your family's baseline is.
Right.
Okay?
Yes.
But in a more conscious way.
Okay.
And then you become more aware, I'm noticing that Anna is leaving a lot more food than I am used to her leaving, or wow, I noticed that Anna is getting up or wants to leave the table, doesn't want to eat with her family anymore.
Okay.
Or I'm noticing,
Yes.
So now.
So those are some of the early cues. So it's observing.
Exactly.
More observing, less blah, 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 blah. Keeping things in order, because that's a lot of times what can happen at the table. Just keeping everything in its place, cleaning it up, and we get in the routines of everything.
Exactly.
Wow, I love that. I love that. Now, is there anything that we should know as parents that we should avoid saying, such as make sure you eat everything off your plate? Clean your plate club. I don't know. Is that's sort of
what I will say about that is there's no general answer to that question. I say that based on applying it to each family system and how they're working, what their values are.
Okay.
Because to cut off communication or making any comments about food and eating may not really be authentic. It may not necessarily be a supportive thing for a particular family system.
Okay.
If we're dealing with a heightened experience where there's disordered issues that we're aware of, it's wise to actually avoid food commenting at all.
Okay.
It's wise to avoid commenting on appearance at all.
If somebody has a true disorder.
If they have a true disorder.
Okay.
In terms of, that's why I said we're chunking this up. There's different answers depending upon which type of situation that we're referencing.
Okay.
So if we have a typical regular family system, how to really look at the language that's used to describe food, how to check as adults your own food patterns and habits and behaviors, the way you speak about your own body,
Right.
the literature or media material that is around the home.
Yeah.
So it isn't so much, well, don't comment on the plate.
Okay.
If there's a particular value system for a family in terms of how they manage the dinner, now notice what I'm saying, and how they manage dinner time. So there's a
Okay.
management here.
Right.
So is it family style? Is this people serve themselves?
Right.
Is there an expectation that everybody plate what's exactly put on the table, whether they
Gotcha.
eat it or not?
Yeah.
Because what parents' responsibilities are
Yes.
is what they offer, what they serve,
Okay.
when parents are in charge of deciding meal times beginning and end,
Okay.
and where.
Now, what about what if somebody doesn't like what you're cooking?
So what is
So-
that like? So what if somebody doesn't like your cooking? So what do you do about it?
Sometimes that happens.
Yeah. So what do you think about that?
So usually I just say, okay, there's peanut butter and jelly
Oh,
as an alternative. If
Mm-hmm.
you're really not up for what I made, you can have a peanut butter and jelly or a turkey sandwich or something. Is that?
it's totally fine. It's okay.
Okay.
It can get it's a little slippery slope in terms
Okay.
of. So, if we were to consider that food and eating is about developing a practice, okay, that we take for granted,
choosing love.
right?
Practice.
It's a conscious choice
yes.
to develop the skill of eating.
Okay.
So parents are responsible for providing the opportunity for a
Right.
child to expand and grow and challenge themselves with food and
Right.
eating.
Okay.
So if there's always, I'll use an extreme example, somebody who shows up at the dinner table, and there's plenty of people who have this experience,
Yeah.
all my child will eat is chicken nuggets and fries.
Right.
And, okay, very classic.
Yeah.
So how do we work with that?
Yeah.
If we always provide the chicken nuggets and fries, there's no offering
Right.
for that child to
And the
develop.
offering is the practice.
Correct.
Okay.
Okay, and so that's why I'm saying it's individualized. It would be individualized for the child because
Right.
every child is different. And how do
Right.
we approach that in a very loving, kind, respectful way,
Okay.
rather than it being punitive
So
and
I
forceful?
mean, what I'm hearing you say is it's really about respecting our own families, our own values, not comparing ourselves to other families,
Correct.
or even taking in too much outside information. Because, like you said, there's so much. Do this,
Correct.
don't do that. Say this, try this,
Correct.
and really, it's about being together. It's about that sense of connection.
Correct.
Right. I love that. I have to ask this because I know if I were watching the show, I would want to know this. How do you handle when somebody feels like they're getting fat? A child says, I feel fat, or I'm fat, or
Yep.
starting, I notice in middle school, particularly with my daughters, they're starting to check each other out.
Right.
Body-wise, they're checking out who's eating what, how much, what they look like, and they're not even fully developed yet.
Exactly.
And they start comparing each other. So
Exactly.
how do we handle that?
Part of how I work with that in my practice is to start to teach the language of emotion.
There we
Fat's not a feeling.
go.
So what are some feeling words?
Love
I
it.
feel anxious.
Okay.
I feel overwhelmed.
Yep.
I feel big,
Yes.
bigger than I can tolerate. Even though big's
Yes.
not an emotion, but trying
Yeah.
to have them. So I have this great little handout, and it
Yeah.
talks about
Yeah.
how to cross out, how to translate that fat feeling. And it
Yeah.
isn't disagreeing that they feel fat. So I honor
Right.
that. That's their experience. But try to
Right.
expand the offering
love
into
that.
crossing off the word fat and substitute
Yeah.
the word uncomfortable. Because a lot of times when we start talking about emotion words, there's not a
Yes.
lot of resource yet to be
Yes.
able to always pull up those words. So we might,
Right.
as adults, think, oh, well, how do you feel? And like
Right.
it's, the sky is blue and there's a lot
Yeah.
of resource. There's not a lot of resource with a lot of the individuals that I work with.
Okay.
So starting with the word uncomfortable
Yeah.
is putting a little buffer
I like
between the
that.
experience of the body and the language that's being used.
Right. Right.
so uncomfortable. And then we
Yeah.
might become curious, and
Right.
curious is what opens the heart.
Love it.
Okay?
Love it. Yeah.
Curious is what expands, right, as you know.
Yes.
So becoming curious about the uncomfortable feeling.
Yes.
And so we start to
Yeah.
gently move it away from something's wrong with the body.
And that includes the parent too.
Yes.
Because it's uncomfortable for them and it's uncomfortable for the parent to hear, just to even hear their child
Yes.
voicing that. I mean, we're
Yes.
glad they're coming to us, but to hear it it brings up quite a bit of like, oh gosh. What do I say?
I
What do I
know.
do? How do I, that you start second guessing yourself because none of us were really given the tools to be able to handle this. It reminds me a lot of choosing love, though, of course, because I always say
Right.
choosing love doesn't come from the head,
Exactly.
right? It comes from feeling. And
But every point you bring up is such,
Yeah.
there's such rich
yeah.
material beneath that, because
Right.
a lot of times I end up doing a lot of coaching with moms that bring their daughters in, dads as well, but more
Yeah.
moms, and about what it brings up for the mothers, because parents bring their kids in
Right.
with a developing body that's looking a little bit plump,
Yeah.
and so I feel fat, and I have a dialogue with parents. The parents are bringing the child in so the child doesn't get fat, because I don't want that child to be made fun of like I was.
Right. That's a good one.
Okay?
Yes.
And so now there's a transference. There's a little bit
Yes.
of that projection
So-
onto the child.
Yes. Yeah. Wow.
Yes.
This is so good. This is
So it's very
good stuff.
expansive, all these different ideas and concepts and
Yeah.
points about
How does
love.
choosing love, I mean, what are the benefits of, I said we were going to talk about what are the benefits of
Yes.
choosing love, and what do you see the benefits of love as you're referring to it as an emotion,
Yes.
an energy. When you say nourishing, I mean that's
Right.
all in the same.
Choosing love, in a nutshell, to me, is about expansion. Is about working on the level of the mind and starting to work with stories and understanding that the stories we tell ourselves are translated into the way that we live. So how
Yeah.
do we expand
Yeah.
and begin to think about new stories? How do we go into that place of feeling and
Yeah.
instead of closing down, becoming curious and opening up to what our heart's offering us, and to go into the body and start to re-inhabit the body. The classic aspect of disordered eating is that we split our mind and body from each other.
Wow. Yeah.
So it's literally
Yeah.
the brain, the mind becomes
Yeah.
separate.
Yeah.
So coming back into the body is a way to choose love through breathing,
Wow.
through movement, yoga, stretching, dance,
Yeah. Awareness.
awareness.
Wow. Wow. Well, that's all the time we have, but I
by
hope
fast.
that you come back. I mean, this was wonderful, and we're going to make sure that we have Stacy's information for you on our new Facebook page. We have a new Facebook page called Choosing Love. It's a page. You can go to that page and like us. And on that page, you're going to find my book, Choosing Love. You're also going to find Stacy Richmond's information, how you can get a hold of her. And I want to be clear, there's also a Choosing Love group. So you have choices, or you can belong to both. The group is a community of people that are choosing love every day with inspirational quotes, prayers, really insightful comments, and you're more than welcome to join the Choosing Love group or the Choosing or the Choosing Love page. That's all for today. My name is Sherianna Boyle, and I want to thank you for choosing love.